Good morning, everybody. This city always moves me because people are so strong. People fight back no matter what we go through. New Yorkers fight back. And we have fought back throughout COVID. We're fighting back now as we overcome the impacts of the storm last week. I was in Flushing yesterday. I saw homeowners, renters who had really been put through hell, but people were helping each other. People were coming back in every way they possibly could. They needed help, and we were there with the help people needed, and we're going to stick with people until each and every household has what they need, whether it's food, whether people need to stay in a hotel, help dealing with all the debris, whatever it is. Was a tough situation, actually one of the hardest hit blocks in the entire city. But what I also saw was tremendous belief among the people there that they could fight back and they want to help each other. And I wanted everyone to see that the city was going to be there for them for the long haul. I want to thank all of our city agencies who've been part of this effort to help New Yorkers. We talked about sanitation and so many other agencies doing so much to help people. And I want to thank all of our first responders, all of our public employees who are out there every day helping people through. It's painful what a lot of folks have been through, but we're going to help them back. I also have seen folks out there helping community organizations, faith organizations, elected officials, making sure that people get the help they need. I want to remind all New Yorkers, if there's anything you need in any language, call 311 or go to nyc.gov/IDA. We particularly want to make sure people sign up for the federal support, the FEMA aid. There's a lot of different kinds of support out there. Federal, state, city, we want to get all the money into people's hands we can as part of the comeback. But if anyone needs help with any forms, with any answers, in any language, the city is there for you. But as I said, there's been extraordinary efforts on the ground, and some of our elected officials have really gone above and beyond to help community members. When we were in East Elmhurst, we saw a block that went through so much. We saw when President Biden visited, it was so good that he was here. I had a chance to talk to a lot of the neighbors, what they've been through, and a lot of them said they were thankful for all the help. They were particularly thankful for their state senator who had been there every day dealing with whatever came up to help people through. I really want to thank her for her effort in this crisis, but what she does every day in the state Senate on behalf of New York City, and particularly on behalf of working people. My pleasure to introduce State Senator Jessica Ramos.
Hi, good morning, Mr. Mayor. Thank you so much for having me this morning, and thank you so much for coming to visit this week and being so hands-on with city agencies. I want to especially shout out the commissioners and teams at Community Affairs, at Sanitation, at the Department of Environmental Protection, and many others who have been on the ground over the past few days to make sure that our folks are taken care of. Look, this is about protecting the American dream for our neighbors. These houses have been built and paid for by the blood, sweat, and tears of working families. And, you know, unfortunately, because mortgages are so high, they end up having to rent basement apartments. People, because of the affordable housing crisis, more often than not, don't have a choice. And unfortunately, because of climate change, because of our decisions and how we've changed how weather works for us, we have really put people in very vulnerable situations. And in that alleyway between Astoria Boulevard and 24th Avenue in East Elmhurst, you know, our neighborhood is shaped like a bowl. That's the geography of the neighborhood. And unfortunately, they're at the bottom of the bowl. They got 6 to 9 feet of water. And we were fortunate that nobody was lost on that particular block. But you know, everything that they've worked so hard for, including many of them who drive taxis, lost their tools of the trade and will have a harder time getting back on their feet. And that's why we're here. That's our role. That's our role as government, is to help them get back on their feet. So I just want to thank everybody, even the local restaurants and food trucks who have stepped up to come on to the block and help our folks. The road to recovery is going to be long, but we keep asking President Biden, we want Governor Hochul, Mayor de Blasio, for us to continue being partners in really, truly investing in the infrastructure upgrades that we need. Our sewage system is antiquated. It cannot withstand the population increase that we've seen in New York City. And that sewage backup is what has caused such terrible flooding across Queens and in other parts of our city. I'm very, very eager to get to work on these issues, and hopefully it won't be too late before the next storm hits us.
Amen. Thank you. Thank you very much, Senator. We're all going to be working, absolutely. And I have faith in a really powerful way that the federal government, state government, city government are actually going to be able to work together to make some of these big changes, especially with President Biden doing so much to get us huge amounts of infrastructure money so we can bring those sewers up to a new level and all the other things we need to do. But thank you for your leadership. We're going to need your help in Albany. And thank you for everything you're doing on the ground in your community. Thank you.
Thank you, Mayor.
So everyone, we continue to work with communities, but we also have a lot ahead in these coming days on so many fronts in the city. It's a very important time for New York City, a very important time in our recovery from COVID, very important time as we fight back. So Monday, of course, first day of school, crucial moment for families, for parents, for kids, crucial moment in New York City's comeback. All our kids coming back together. Also on Monday, the key to NYC goes into full effect. Our effort to protect people who go to indoor dining, fitness, entertainment, protect the employees, protect the patrons. Our vaccination campaign continues full speed. There's a lot going on. Let's talk about vaccination first, because vaccination is the way to get so much done to protect us and move us forward. So we've been talking about our Vax to School campaign all summer long, and it's pretty amazing. Over 65% of 12 to 17-year-olds vaccinated. We expect that number to go up a lot in the coming days. And we want to help make it as convenient as possible for families. If they have not gotten their children vaccinated yet, if you still haven't had that opportunity, of course, there are vaccination sites all over the city available for you for free. We'll even have vaccinators come to your home in these next days. But we also want to make vaccination available in our schools the first week of school. So announcing now, every school that has kids 12 years old and up, that's over 700 school buildings, will have in-school vaccination sites next week, every single one. And they'll be open all week long. Any student who is not yet vaccinated can get their first dose if they're 12 years old or up. Any student who's ready for their second dose, who's had one, but now the time has come for the second, can get their second dose. We're going to have that up all week, next week, 700 buildings. And then we're going to bring it back during the week of October 4th to those same buildings to make sure the kids who got their first dose next week get the second dose yet. Again, thankfully, almost 2/3 of kids in this age range have already had that first dose. That's great, but we want to keep it going, keep it moving, make sure kids get fully vaccinated. We're going to use every tool we can because we believe in bringing back our kids to school, every single one. And I want to talk about this and then bring in really one of the greatest experts in this whole nation. My simple point as a parent who had my kids go to New York City public schools the whole way through, pre-K to 12th grade, our kids need to be in school, and it's unbelievable that some kids haven't seen the inside of a classroom for a year and a half. There are massive consequences to that, including healthcare consequences. The healthiest, best place for kids to be is in school, and we have really outstanding health and safety measures in place to make sure our kids will have a positive and safe school year. I want you to hear from a leading expert why it's so important and why her organization, the American Academy of Pediatrics, the ultimate voice on the health and well-being of our kids, why this extraordinary organization believes that every child needs to be back in school. I want to thank her for her great leadership, and it's my pleasure to introduce Dr. Lee Beers, the president of the American Academy of Pediatrics.
Well, thank you so much, Mayor de Blasio. I want to really recognize the efforts you are just describing about getting your children back to school. I think these, the type of partnerships you describe between health and education really are so essential to ensuring that our children can consistently have access to in-person education. You mentioned your kids. I am also the parent of 2 teenagers who are fully vaccinated, by the way, and they are just delighted to be back in in-person school. You know, and at the American Academy of Pediatrics, throughout the pandemic, we've actually worked together with our experts to prepare guidance on how we can best make sure our kids are safe, healthy, and thriving. And a big piece of that is how to safely return to in-person learning. I think you mentioned this, but in-person and in-person learning is so important for children and teens. It's important to their education, but it's also important for all the other sort of wraparound things around that, mental health and nutrition and exercise, all these other pieces. And so it's really important for us to prioritize our resources as you describe. We also know from our experiences over the past year, children can return to school safely when we use layered precautions such as vaccination, universal masking for children over 2 and adults, symptom screening, improved ventilation, testing, all this whole sort of layering of measures can get our kids back to school safely. And I'll talk for a minute about vaccination, particularly as this is our focus today, but vaccination is an extremely safe and effective strategy to prevent COVID in teens and adults 12 and up. But we also know there are many who've had trouble accessing vaccination or who may still have some questions. And so we also know that the more who are eligible, who are vaccinated against COVID, our youngest ones aren't yet eligible, and that helps protect them. And so there's so many reasons for our adolescents and our adults to be vaccinated. And so I think, again, as I mentioned, these innovative partnerships between health and education are one way that we can reduce these barriers. And there are places also for families to be able to ask their questions. You know, I share this with people a lot. As a parent, I had questions before I got vaccinated myself and before my teens were vaccinated. And so that's normal and okay, and families should have the opportunity to have their questions answered. So in addition to the partnerships like you describe, I encourage families to reach out to their pediatricians for any questions they may have, and also actually to make sure that their kids are up to date on all of their other routine immunizations. You know, we have a number of resources that we make available to pediatricians as well as education for our families. We have a wonderful website, healthychildren.org. So absolutely, you know, take a look there, and there's lots of good information there. And I also know that you in New York have wonderful partnerships with your pediatricians and with your local chapter of the American Academy of Pediatrics. So you have tremendous partnerships and resources available to you. So again, thank you, Mr. Mayor, for the opportunity to join you today. I just really am encouraged and heartened to see this wonderful partnerships that you've described, as well as the really comprehensive common sense precautions that you've implemented to get our kids back into school safely. So thank you so much.
Thank you so much, Doctor. Thank you for your leadership. You and your colleagues have been such strong voices for getting our kids back into school and doing it the right way. And also the pediatricians, you're right. I can tell you as a parent also, there's no one you listen to more than your pediatrician. And when our pediatricians are saying, get vaccinated, get back to school, it is so helpful, so reassuring to parents. So thank you to you and all your colleagues for everything you're doing to help us overcome COVID.
Great, thank you, thank you.
All right, everyone, now, we're very excited about the opening of school. It's one of the greatest moments of the year. Each year, first day of school, amazing, positive, hopeful. And of course, we have a powerful set of tools we're using, including a mandate for all the adults in our school buildings to be vaccinated. We are going to keep adding additional elements to our approach to vaccination, particularly when it comes to those who serve our young people. So I've said we'll climb the ladder, and today we're climbing the ladder again. We're going to announce an additional vaccine requirement, not just for those who work in our Department of Education buildings, but also expanding to all city contracted childcare and after-school staff. These are folks who do incredibly important work, who families depend on, kids depend on. We need them to be safe. So for all city contracted childcare and after-school staff and all the organizations that are our partners in this work, we are putting a mandate in place. Starting today, we'll announce it, and it will be active on September 27. By September 27th, employees must show proof of at least one dose of vaccination, same date as for Department of Education teachers and staff. Now, this will include staff at city contracted sites. Again, there are others that are not city contracted. That's different. We're talking about city contracted pre-K, 3K, early learn programs, home-based childcare, after-school programs, beacon programs, cornerstone programs. All of these are so important to supporting our young people, and we want them to be very safe environments. I want you to hear from someone who's been a powerful voice in the fight against COVID throughout, but he also is a father of a young child in childcare, so he knows how important this is. My pleasure to introduce Council Member Steve Levin.
Thank you so much, Mayor, and I just want to thank you for your efforts. I see Dr. Toshki on the line as well. I have my 2-year-old with me here, so listen. I want to thank you so much for the efforts around vaccination. The announcement today of requiring all staff on for child care centers to be vaccinated is so crucial, because until we are able to have all children vaccinated, we need to make sure that we're able to protect our children by making sure that those around them are vaccinated. And so, Mayor, I'm being summoned, but it is absolutely crucial, And I was just looking at the latest data and looking at our transmission rates around the city, and we peaked in this latest wave of Delta variant. We peaked in August, and in the last 3 weeks, the numbers have gone consistently in the right direction. We need to build on the success that the administration has made happen in the last month, and I really apologize. Mayor, I thank you so much for these efforts. They are crucial, and they're making a huge difference, and we're really bending that trend downward every single day. So thank you so much, Mayor, and my apologies for that.
No,
for the noise in the background.
Councilman, nothing to apologize about. We're talking about childcare, and you have your child there. But listen, that is a bold move, bringing a 2-year-old with you onto live television. I admire that. That shows faith. But thank you for your leadership, and I'm glad that you can attest to everyone how important it is to have safe environments for our kids in childcare and after school. Thank you, Councilman.
Thank you, Mayor. Thank you.
I want you to hear now, everyone, from someone who plays an absolutely crucial role in ensuring that childcare is available to the people in New York City, that we have exceptional childcare facilities, safe childcare facilities for kids and parents and the staff alike. And she does really important work advocating for the childcare community and making sure government is always working in partnership with all the people who do this beautiful work. My pleasure to introduce the Executive Director of the Daycare Council, Tara Gardner.
Good morning. Oops, double sound, sorry. Good morning, and thank you. Sorry.
That's okay. At least you don't have a 2-year-old with you, so it's going to go better.
Early childhood provider organizations for New York City to return to work. Our families must be able to access safe, high-quality childcare. And early childhood staff are essential workers, and our members are working hard to ensure that programs are safe and nurturing and educational. And the Daycare Council of New York's members are looking forward to welcoming children back to in-person learning and supporting their families as they recover from the pandemic. Many have been open for months, providing services to working families throughout the summer. And the young children that the Daycare Council's members serve cannot be vaccinated, so it's even more important that the adults who interact with them are protected through vaccination. There will certainly be questions about the implementation of the mandate, and the Daycare Council will work collaboratively with our member organizations, with Mayor de Blasio's office, and the Department of Education, and our partners in organized labor to address issues that staff members face and provide clarity on protocols. We must all work together to ensure that all adults who work with and volunteer in early childhood education centers have received a vaccine against the COVID-19 virus to help stop the spread of the disease and protect everyone in the centers and in the community. And the Daycare Council looks forward to continuing to work with the city and our partners on this initiative. And we thank you.
Thank you so much, Tara. We are going to work together. We want to make sure that we are all working through the details, but thank you for affirming how important the goal is. To keep our kids safe, give our families confidence. That's why we need everyone vaccinated. We're going to work closely with you to make it work. Thank you so much, Tara. All right, now, all of the tools that we've used, the educational efforts, outreach efforts, the mobile vaccination, in-home vaccination, incentives, mandates, everything is having an impact. We are closing in on 11 million doses of the vaccine from the beginning. But we know we can go farther, and that means working even more closely with doctors. Nothing is more important to a New Yorker than hearing the voice of their own doctor. We've created something new and powerful, the physician referral bonus incentive. This is an idea that we were hoping might come from the federal or state level, but we're doing our own version now because we think it's so important, particularly for doctors who serve a lot of patients on Medicaid or Medicare, many of them being the patients at greatest risk. So we're doing a $35 million investment to drive up vaccination rates, to get these doctors to systematically work through their patients, talk to them, answer their questions, recommend the vaccine, talk about why it's safe and effective, make the appointment, or get them referred to a nearby site for an appointment. This is going to make a huge impact. I want you to hear from our doctor, the city's doctor, Health Commissioner Dave Choksi.
Thank you so much, Mr. Mayor. Well, my fellow healthcare providers are a major part of why we've reached over 71% of adult New Yorkers who are now fully vaccinated, and why we've reached so many children via their pediatricians, as you heard from Dr. Beers earlier. Together, they were critical in administering over 462,000 first or single doses in August, which represented a 53% increase over our July total. About 60% of those first or single doses were administered to Black and Latino New Yorkers, patients for whom a conversation with a trusted clinician is often particularly important to help surmount skepticism born of historical discrimination and marginalization. But we all have more to do to get to the finish line. And so today, as the mayor said, we are announcing a new $35 million program for clinicians to support them in having these crucial vaccine conversations. We're working with Medicaid and Medicare Advantage plans who serve some of the most vulnerable New Yorkers to identify unvaccinated patients in their networks and to reimburse their healthcare providers for engaging with them. To be eligible to receive the payment, in each conversation, providers must discuss the safety and effectiveness of the vaccines, recommend the authorized vaccines, and arrange vaccination for that patient. The physician referral program builds off of our Use Every Opportunity campaign, which embedded vaccine conversations in all types of routine clinical encounters, whether the patient is visiting for a diabetes check or for a physical exam. And for clinicians who are out there listening, we've gathered all of those resources at nyc.gov/vaccine talks. Today, as part of this campaign, I'm also issuing a commissioner's advisory to all healthcare providers, emphasizing the urgency of these vaccine conversations. We are taking these steps because a provider's strong recommendation can make all the difference when it comes to getting a COVID-19 vaccine. So I thank my fellow healthcare providers for all they've already done and urge you to continue reaching out to your patients. Help them understand the science behind the vaccine and reassure them. You have all already saved lives, and this program is an investment in you and your care. Thank you, sir.
Thank you, Dr. Choksi. I want everyone to hear from another leading healthcare provider and someone who's part of the leadership of Somos. Somos has done amazing work getting New Yorkers vaccinated. we are so appreciative because also Somos has led grassroots efforts, community doctors reaching out to their patients, absolutely crucial. One of the leaders of Somos, board member, Dr. Francisco Rosario, joins us now. Doctor, welcome.
Good morning to everyone. I'm Dr. Rosario, an American internal medicine board certified and a community doctor in the network of Somos. On behalf of Somos and myself, we thank you, Mayor de Blasio and the city for giving us this opportunity in being part of the physician referral bonus. And about Somos, we are about 3,000 community primary care provider that we have started with the testing when nobody wanted to be doing testing. People were afraid. We then started with the vaccination center. With the vaccination center non-stop, we have vaccinated over 1.2 million New Yorkers. And as we all know, our strongest weapon is the immunization. And this is the best time in the time of going back to school to incentivize this program. And we encourage all physicians to join into this program. And for all those 12 and older who get vaccinated through one of our vaccination sites, we will be providing one of the comics of Marvel. Somos have partnered with Marvel for another way of incentivizing. And it's okay to have questions with the vaccine. Yes, it's understood, but this is our way of opening the dialogue and initiating the process of vaccination. When we are informed, especially through physician that speaks your language, and understand how you feel, that we are in the same culture, it will be easier for the patient to understand and for the parents. And we thank you, Mayor de Blasio, for giving us this opportunity. And en español, bien breve, quiero decir que Somos se ha hecho un partnership, y con Marvel, para aquellos que se vacunen, se le va a dar un panfleto que son limitados a la primera 20,000 niños por encima de 12 años que se vacunen. And from Somos, we encourage other physicians to join into this program of the physician referral bonus. Thank you, the city. Thank you, Mayor de Blasio. We really appreciate it, and thank you.
Thank you, Doctor. Thank you so much. Thank you for everything you're doing and everyone at Somos is doing. It's been tremendously helpful. And you're one of the reasons why New York City is coming back. Thank you very much. Muchísimas gracias. Okay, everybody, vaccination unlocks our recovery. It's as simple as that. Vaccination equals recovery. And that's why we focused on vaccination wherever it's going to make an impact, and that's why we're doing the Key to NYC. Indoor dining, fitness, entertainment, et cetera. Let's talk about what this means for the big picture in New York City. Look, restaurants are the heart and soul of New York City in so many ways. Such a crucial part of our culture, part of what New York City is most famous for, part of what expresses all of the communities that come from this city. But restaurants are part of our lives. For so many people, it's a neighborhood restaurant or bar, some place that they have gone to throughout their life, generations have gone to, that is just part of what gives them a bond to their neighborhood and their city. I want to use an example I think a lot of Brooklynites will appreciate. I was just there a few days ago, a Southern Brooklyn legend, an institution in Brooklyn that people love, Brennan and Carr, amazing place, family owned. It's been there since 1938. Generations after generations have celebrated great moments in their lives there. In that picture, I'm there with Mike Sullivan, one of the owners who's done an amazing job keeping this beautiful institution alive, and Jackie Hunter, who's done a lot of great things for New York City. I want to thank them both. It's a beautiful story of a family restaurant that endures. And they've had to fight through COVID. They've had to deal with all the challenges. To their great credit, they went and got all of their staff vaccinated. They went the extra mile, particularly with the young people on their staff, to get them vaccinated. I want to thank Mike and everyone there for making that happen. But this is the kind of place that people cherish. If you love roast beef, it's an amazing place for roast beef, but even more than the food, it's some place that just makes you feel good about Brooklyn and New York City, that it's still there, and those memories are strong, and new memories are being made all the time. So again, we think about restaurants, it's a lot more than just where you go for a roast beef sandwich. It's part of our life, it's part of our culture. And that's why we need our restaurants to be open and strong. We need everyone who goes to eat in a restaurant to know they're safe. We need the employees to be safe. That's what Key to NYC is all about. Next week, after about a month of education and supporting restaurants, helping them get ready, and all the others, indoor entertainment, fitness, we're going to start implementing the law more fully, and enforcement will begin on Monday. But let me be clear, we want to help people succeed. We want the restaurants and all the other businesses to succeed. No one is starting this out with the intention of fining. We don't want to fine. We just want people to be safe. We want to make sure people are doing things the right way. And I think the vast, vast majority of businesses are committed to doing it the right way. We're going to have inspectors out. It will be civilian inspectors from 13 agencies. We're going to have that poster that we've put forward out to help educate people what we're going to do. Inspectors will come out, make sure the check-in procedure is going right with the ID and the vaccination proof, making sure the business has posters up or other notices up that they have a plan for how to approach it, indoor dining, entertainment, fitness, making sure it's working. And we're going to make sure everyone's safe. That's the key, because it's what will give people confidence. It'll give them confidence in each business they go to, confidence in the comeback in New York City. It's going to help us overcome COVID once and for all. I want you to hear from someone who's really done amazing work. First of all, her restaurant is just extraordinary. Shirley and I went there months ago and can't recommend it enough. Melba's in Harlem, amazing food. But also, she has gone the extra mile to help get people in the Harlem community vaccinated. She's opened up the doors of her restaurant to incentivize, to make it positive. She's worked with community to spread the word about how powerful vaccination is. And she's also been a voice for all restaurant owners, making sure we did things like outdoor dining, which has proven to be such an amazing success. She's one of the voices, she's one of the leaders that helped us to get to that. So not only does she own and run a great restaurant, but she's also president of the New York City Hospitality Alliance. My pleasure to introduce Melba Wilson.
Good morning, Mr. Mayor. I'd like to start off by saying a sincere and a heartfelt thank you for all that you do to keep our city safe. You know, my heart breaks when I look at other cities in this country and people that are not enforcing vaccination, and also understanding the importance of vaccination. So thank you so much for all that you do on a regular basis. Joyanne Reed and I were talking a couple of weeks ago, and we're devastated about the fact that so many people, African Americans and Latinos, were not getting vaccinated. And we sat down and we said, what can we do? What can we do? We decided to hold a Vax rally at Melba's, and Dapper Dan, the fashion icon, Debbie Smith, came out to support, as well as my cousin, Dr. Sampson Davis, who's an author and who also vaccinates people. Chef JJ from Field Trip came out. But what I think was most important is that people in our community, they see that we are you and you are us. There's no way in the world we would recommend that you do something that we thought or that we felt would hurt you. Now, I've gone to school in Harlem for most of my life, and I can tell you, I remember getting vaccinated as a child. So we've all been vaccinated before. When I went and got vaccinated recently, or last year rather, I was scared. I was concerned. I was worried. So I understand. Actually, I don't understand. I overstand the apprehension. However, if I'm going to roll the dice, I'm going to roll the dice on saving my life. Right now, I personally have 3 dear friends of mine. One who's been in the hospital for 6 weeks, in ICU, on a ventilator. 2 others who have kids that have been hospitalized, one for 2 weeks, one for almost 3 weeks now. The thing that all 3 of them have in common is that none of them are vaxxed. None of them are vaxxed. They're in the hospital with COVID. A vaccination would have saved their lives. Could have saved their lives, could have saved them from being in the hospital. This is not a joke. This is real. This happens to people that we know and people that we love. If you don't want to get vaccinated for yourself, get vaxxed for the people that you love. I'm a single mother of a 21-year-old son. I have an 80-year-old mother and a 77-year-old father. If you don't want to do it for you, do it for the people around you, the people that you love. One thing that COVID doesn't do, it doesn't discriminate. It doesn't care. It doesn't care about your financial status. It doesn't care about your education, your life. It doesn't care what kind of job that you have. Any and all of us can catch COVID. So let's be prepared. Now, this is not a sprint. This is a marathon. So it's about us spreading the word, okay? This is a win-win for our communities. You getting vaccinated, it's not just a win for you, but it's a win for the people around you. This mandate that starts September 13th, that will be enforced on September 13th. Let me just tell you, this is not a good thing, this is a great thing. It's about keeping our city safe. There are over 8 million people in this city. If you have any questions, call 311. Reach out to Small Business Services. I can tell you that there's also a business sign-up referral program. Okay, so for every person that you sign up, you'll be compensated. Now, the money, yeah, that's okay, but what's most important is saving lives. Saving lives is priceless. It is invaluable. So when I say to you, get vaccinated, I'm telling you this because I care. Because I don't want to look to my left or look to my right and see people that I love and that I care about gone. I also want to talk a little bit about September 13th. This is a big day for all of us, okay? I want to thank the mayor because I know here at Melba's and there's so many other restaurants, I've spoken to other members of the Hospitality Alliance. Thank you. People have been coming in to our businesses to make sure that we have the correct signage, that we have the correct verbiage, so that we know the correct way to approach our customers. It's about to get cold in New York City, so outdoor dining is not going to be an option for too much longer. So we want to make sure that when people enter into our establishments, that they're vaxxed so that not only are they safe, but our restaurant families are safe too. Now we know that restaurants are we're the cornerstones of our communities, right? If there is a fundraiser that you need, you come to your local restaurant. Can I get a gift certificate? Can I get some food? Can I get a check? And we're always there for you. So when a restaurant shuts down, it's not just a physical space. It's an ecosystem that's failing. It's the fishmongers, it's the produce people, it's the truck drivers, it's the paper good suppliers. It's also the people that pay bills, that work with us and that work for us. So we want to make sure that we keep our community restaurants going But most importantly, we want to make sure that we keep our communities healthy. If I can be of any assistance, don't hesitate to reach out to me. My email, melbaspa@melbasrestaurant.com. We're not just our brothers and sisters keepers. We are our brothers and sisters. And if not us, who? And if not now, when? Let's do this before it gets too late. Thank you so much, Mr. Mayor.
Thank you, Melba. Wow. Beautiful, beautiful message. And thank you for your passion, your love for your community is coming through, your can-do attitude. I feel like we're in the huddle and the coach is giving us, or the quarterback's telling us what to do. It's great. But thank you.
Thank you.
Thank you for believing that we can all do this together and for what you're doing to keep people safe in the Harlem community. You're an example, literally an example to all New Yorkers. Thank you so much, Melba.
Thank you, Mr. Mayor.
Everyone, so you can hear the focus on vaccination in everything we do. And if you need some proof that it's working, here's today's indicators. Number one, doses administered to date, 10,932,616. We're going to be hitting 11 million doses very soon. Absolutely astounding, growing all the time. Number two, daily number of people admitted to New York City hospitals for suspected COVID-19. Today's report, 121 patients. Confirmed positivity of 26.72%. Hospitalization rate per 100,000, 1.17. And then new reported cases on a 7-day average, 1,315 cases. I want to say a few words in Spanish, and you guessed it, the topic is vaccination. Las vacunas son la clave para recuperar nuestra economía. Por eso estamos abriendo 700 sitios de vacuna en nuestras escuelas y la vacuna será requisito para disfrutar de actividades interiores como ir a comer al gimnasio y más. Así es como vamos a recuperar de nuevo la ciudad que amamos de manera segura. With that, let's turn to our colleagues in the media. And please let me know the name and outlet of each journalist.
Good morning. We will now begin our Q&A. As a reminder, we are joined by Health Commissioner Dr. Dave Choksi, Dr. Jay Varma, Senior Advisor on Public Health, Dr. Ted Long, Executive Director of the Test and Trace Corps, Emergency Management Commissioner John Scrivani, Small Business Commissioner Janelle Doris, Environmental Protection Commissioner Vinnie Sapienza, Sanitation Commissioner Ed Grayson, and Do-It Commissioner Jesse Tisch. Our first question for today goes to Andrew Siff from NBC.
Good morning, Mr. Mayor, and everyone on the call. Mayor, with regard to vaccinations in schools, why not mandate it for kids 12 and up? Los Angeles is doing that. You've talked before about a stepladder approach and keeping options on the table, but why not mandate it right now?
We just don't think that's the right thing to do, Andrew. We are seeing, first of all, among the kids who are eligible, we're at almost 2/3. And we're going to be moving constantly to increase that number. But the most important thing right now is getting kids back in school. If there's a family that's not yet ready, I don't want that family kept out of school. I want them in school where we can help their kid, especially for the kids who have been out for the last year and a half. So that's where we are today. We can always, with any option, we can keep any option on the table. But right now, no. We want every kid in school. We want to reach them the ways we're reaching them. Go ahead.
The variations of the remote option, no remote option question, but I wanted to get clarity now that families are paying attention. There are only days to go until Monday. There's still CDC guidance and guidance from your own health department that if a child has cold-like symptoms, to keep them home in the age of COVID. So the question is, if your child stays home because they don't feel well, what does that family do that day? There's no way for them to log into some kind of online learning that day. They lose a day of school for doing that.
Again, Andrew, we obviously, if someone's sick, we want them to stay home. Let's be really clear about that. That's the most important thing. We have, for kids who are going to be in quarantine, a process to provide them with learning. If a child's sick for one day, we'll certainly have DOE update you on how we're going to handle that. But I think the simple differentiation I'd make is, if a child's going to be sick for a more substantial amount of time, we can provide the same support we provide to kids in quarantine. But it really begins with making sure if a child might be sick, keep them home, keep everyone safe.
Our next question goes to Marla from WCBS 880.
Mayor, we are hearing reports this morning that the NYPD is mandating vaccines for all employees, or they will not be able to be paid. Have you viewed the memo that New York One obtained, and are you concerned that some of the force will just not show up to work?
Marla, I want to make sure there's clarity. Maybe I haven't seen what document or report you're talking about. For any new employees, brand new, showing up for the first time, new hires, NYPD or any other city agency, there is a vaccine requirement. That is true. But as you know, because you've been following the details, we have not yet applied a full requirement to all agencies. We have, as of the 13th coming up, vaccinate or test requirement for a number of agencies. Now, if someone, again, does not follow that mandate, it's true. Eventually, they're not going to be paid, obviously. That's been clear for quite a while. But we feel confident that we're going to have adherence and that we can make adjustments if there's any issues. Go ahead, Marla.
And regarding the schools, children are the fastest growing group of those getting the virus, and there is concern about distancing with so many kids returning, especially in cafeterias or other common areas where students will be taking off their masks. With so many kids returning, so many more for in-person learning than last year, how can you ensure there will be distancing, that kids will be safe and that we won't have large outbreaks, especially among the kids who are not eligible for the vaccine?
Well, Marla, we've looked at all these factors, obviously care deeply about keeping our kids safe, and we proved it last school year. When we didn't even have vaccination as a tool, we kept our kids safe. Summer rising, hundreds of thousands of kids in school, Delta variant raging, we kept our kids safe. We know how to do it. And Marla, what I'd emphasize is, if you're in an environment with the right ventilation, with everyone wearing a mask, with a high level of vaccination, with regular cleaning going on and on, all that gold standard we talk about, health and safety measures, you're going to be a lot safer than out in the rest of the community by definition. That's what our schools have proven over and over again. We feel very good about the distancing. We're absolutely able to follow the CDC guidance. We feel very good, as you saw yesterday, about the cleaning, the ventilation, the high level of vaccination, even among the young people who do qualify. So we're absolutely convinced we can bring our kids back, bring them back safely, limit the number of times when anyone's exposed or there's any disruption in our schools. That's what we've been working on for months and months, and we're ready.
Our next question goes to Emma from the New York Times.
Hi, good morning, Mayor. So there was another death at Rikers Island, and that was the 9th inmate to die this year. You said this week that you weren't considering an early release plan. What are you going to do to address the crisis at Rikers?
Emma, we've been taking a number of steps. Clearly, there's profound problems, and there have been for a long time at Rikers. The big step we have to take is to, once and for all, get off of Rikers, just stating the obvious. That is a place that just can't serve properly, and that's the plan the city is 100% committed to. But for the here and now, we have reduced the number of buildings we're using so that we have less of a problem with staff being put into overtime situations. We've put in place a new academy class to bring in more staffing. We have to do a variety of other measures to keep everyone in the facilities safe, and those reforms are being acted on and worked on regularly. It's a very tough situation. COVID has created tremendous disruption in our correction system. but I know Commissioner Schiraldi is committed to just continued changes and reforms. And it's endless work, honestly. It's very, very tough work, made much tougher by COVID, but we are confident that over time we're going to be able to overcome this. Go ahead, Emma.
Thank you. Thank you. So enforcement begins on Monday for the vaccine mandate for restaurants and gyms. How many city workers will be doing inspections? Are you targeting certain neighborhoods or boroughs? Are you starting with restaurants or other types of businesses? What is this going to look like in terms of enforcement?
Yeah, Emma, we're going to be, as I said, using inspectors from 13 city agencies, all civilian, all boroughs, all neighborhoods. So there's not targeting. It will be across the board with restaurants, indoor entertainment, indoor fitness. And again, our goal here is to confirm compliance. And what we saw, and we have a real control model, if you will, Emma. You know, when we went through the worst last year and we asked so much of restaurants and bars and asked people to close and restrict their operations, we saw overwhelming compliance, really overwhelming. I think in this case, there's been a lot of buy-in, not everywhere, but the vast majority, a lot of chance to get ready. We are happy to work with any restaurant, any indoor entertainment facility that has questions at this point, happy to work them through. But I'll tell you, just from my own experience, Emma, I've been out there. When I've gone, I went to a movie theater, I've gone to different restaurants. What I see is pretty fluid right now. People are asking for you to check in the same way they do when in a restaurant or bar, they check your ID before serving you a drink. I think a lot of places are handling it well, and if anyone needs help, they can just call 311 and we'll get them help in how to prepare for Monday.
Our next question goes to Christina from Chalkbeat.
Hi, Mayor. Thanks for taking my question. Can you please talk about what changed in terms of the vaccination mandate for early childhood workers? They were initially excluded, and now obviously they'll have to go get vaccinated. And can you also say, and I know Ms. Gardner is on this call, have the details been negotiated with labor in terms of what happens to those who refuse, and will there be exceptions?
Yeah, I don't know if Ms. Gardner is still on the call or not, but I'll just say, Christina, always with labor, we're going to instantly go and negotiate for those who are represented by labor unions. I don't think that's everyone in this group. But the why, to your central question, we continue to look at the overall situation, continue to see where we think we can add to our strategy effectively. And that's the whole idea of climbing the ladder. But also it's based on ongoing dialogue. We've talked to a lot of leaders in the child care field. We've talked to them about what's going on in their facilities, what they need. I think what you heard from Tara Gardner about child care is what you heard from Melba Wilson about restaurants. More and more of the people who run the facilities recognize the mandates are going to give confidence to everyone, to the parents of the kids, making sure the kids are safe, to the employees, knowing they're safe among each other, and it's a single clear standard. So we worked with them, and we got to the point of deciding it was time to move this. Go ahead, Christina.
So it sounds like the details might still need to be negotiated, if I'm hearing correctly, but also I wanted to ask about bus drivers. Are they going to be required to be vaccinated? State guidance calls for them to either be vaccinated or tested weekly, I believe. So what's going on there?
I have to get you an answer on that, Christina, because again, today's announcement is about the folks who provide the direct service in the child care facilities, but we'll get you an update on that.
Our next question goes to Chris from the Daily News.
Hi, Mayor. How you doing?
I'm doing good, Chris. How are you?
I'm good. Kind of following up on the last question there. With the new expansion of the DOE vaccine mandate, how many workers are we talking about that are going to be covered under that?
I don't have the exact number in front of me, Chris. It's a substantial number of workers, obviously. You're talking about a variety of childcare and after-school facilities. Now, again, my hope is a lot of folks are vaccinated already. But obviously, many thousands. We'll get you the exact number. Go ahead.
Okay, thank you. And I saw it come in during this briefing. You're supposed to be in the Bronx in 30 minutes to deliver remarks at the YMCA ribbon cutting. How are you going to get there on time?
Well, we'll probably be a little bit late to that. We have a few more questions, but as soon as we finish here, I'll be going up there. Go ahead.
Our next question goes to Aaron from Politico.
Aaron?
Oh?
Hello, Aaron?
You got me now?
Yeah, Aaron, you there?
Is that better? I'm not sure what's going on. I can hear you just fine, but...
Okay, Aaron, can you hear me? I can hear you.
Yes, I can hear you.
There you go. You're good to go.
Okay, great. I just wanted to ask, with respect to, Andrew asked something similar to what I was going to ask, but specifically in the context of Governor Hochul said yesterday that it was certainly an option to mandate vaccines for students 12 and up in schools. So, you know, you said you don't think that's the right thing to do. Are you, if the state moves towards that, you know, are you going to reconsider that position? Yeah.
Aaron, if the state mandates something that we're legally required to follow, of course we'll follow it. I'm saying what the city's position is, and so far the state over the last year and a half has generally deferred to the city on matters of schools. We want to make sure every kid's in school. That's our imperative. And we want to make sure every kid's vaccinated who can be. And we find the current approach is really working. Again, we're almost at 2/3 of kids, and school has not yet begun. We expect a real bump up in that in the coming days. But the imperative is make sure our kids in school where they can be safe and served in every way. So that's where I believe we're in the right place. We'll always watch if things change, and we'll always respect any decision that the state makes that's binding on us. But from the New York City point of view, we're where we need to be right now. Go ahead, Aaron.
Okay, thanks. And then, you know, I've asked this question before, but I'm wondering if there's any more clarity at this point. You know, you're doing all these additional measures on vaccine requirements, and the vaccine rate is in fact going up. At what point do you think we see that actually translate into, you know, the cases going down substantially and, you know, this latest wave kind of really receding?
Yeah, Aaron, I would say I've talked to our doctors about this quite a bit. I'm just going to summarize. I think we all are duly noting and are pleased to see that a high level of vaccination is making a big impact. Over 5.5 million New Yorkers have had at least one dose, clearly helping us push back the Delta variant. But the ballgame is not over by any stretch of the imagination. And, you know, once upon a time there wasn't a Delta variant. We're aware that there's always the potential of others. We've got to finish the mission. So progress, we're definitely making progress. We know there's a lot more people who are ready and willing and able to be vaccinated. Some will be moved by mandates, some by incentives, but we can reach many hundreds of thousands more people. So we're going to go do that. But it's too early to say what a timeline would be. I think what we can say with assurance is heavy levels of vaccination are working, that this vaccination effort is working. We're starting to turn the corner. But let's come back, you know, in a few more weeks and see if we have stronger conclusions than that.
We have time for 2 more questions today. The next question goes to Elizabeth from Gothamist.
Good morning, Mr. Mayor.
Good morning, Elizabeth. How you been?
I'm good. We were looking at the vaccination rates across the city's workforce. And since you have some of these commissioners on with you today, I just wanted to maybe just read out some of them. DEP, we see a 54% vaccination rate, EMS 54%, and sanitation came in at the lowest at 44%. I'd be interested to know from you and these commissioners why it's so low at these particular agencies. What are the conversations that they're having with their staff who are reluctant to get the vaccine?
Okay, I'll say this. It's a great question, Elizabeth. We're all dealing with the fact that, unfortunately, in a crisis, in an era where we should be all pulling together, a lot of our employees are being treated to a lot of misinformation I know that's a big part of the problem. And our job is to keep working through that meticulously and using a variety of tools to move people. I think you're going to see the incentives and the mandates having more and more impact. I'll turn to Commissioner Sapienza, Commissioner Grayson. I want you just to really be brief, because it's true, I'm supposed to be leaving for the Bronx right now. But just in terms of how you're trying to break through to your employees who are not yet vaccinated, Commissioner Sapienza, then Commissioner Grayson.
Thanks, Mayor. I'll just start briefly by saying that we do have some issues with how the number is calculated. The number that's being reported are the number of employees who received the vaccine in the city through the Vaccine Command Center, divided by the number of total employees in the agency. For DEP, that doesn't account for the 1,000 employees that we have who work in our upstate reservoirs and who probably got vaccinated in the 7 counties upstate that they work in. So we think we're actually a little over 60%.
Okay, good. Commissioner Grayson.
Yes, sir. We are messaging. We are doing all we can to provide opportunity and information to our employees. We encourage vaccination heavily, and we are moving ahead with the implementations to try to keep all workforce safe as directed. But our main goal is to make sure our workforce is informed, has every opportunity to know what benefits there are to the vaccine, and keep moving towards getting more and more of our employees vaccinated.
Thank you. Go ahead, Elizabeth.
My second question is about schools. When you first outlined some of the precautions and testing protocol, you said that there might be an at-home testing option for families. I'm wondering if you or the health commissioner can provide the public with more details on that particular option.
Yeah, Dr. Choksi will speak to it, Elizabeth, and it's supplementary. It's not obviously the same thing as our regular testing at every school, but it's an additional tool. Go ahead, Dr. Choksi.
Thank you, sir. I'll start briefly, and Dr. Long may have more to add, but the Test and Trace Corps does use at-home testing, particularly with respect to close contacts, ensuring that people have the at-home test kits to be able to take with them. We are also looking at other use cases for at-home testing, and those depend a little bit on the operations as well as the scientific basis for using them in specific situations.
Dr. Long, you have 30 seconds if you have anything to add.
Yes, just want to make the important point. We want to do testing with the same method, same test in every school so that we can detect the same signal across the board. We do offer at-home testing for close contacts because these are students, teachers, parents that we don't want to leave their homes. But in schools, we want to do the same method so that we can detect any signal at any school. So in-school testing is our main method.
Thank you. Go ahead.
Our last question for today goes to Yehudit from Borough Park 24.
Hi, good morning, Mr. Mayor.
Shana Tova, Yehudit.
Shana Tova, we want to wish you and everyone on the call a sweet, happy, and healthy New Year.
Absolutely. How are you doing today?
Great, excellent. So I want to thank you for the increased police presence at Borough Park this week as our month-long holiday season just got started. And especially in light of the FBI's recent report that Jews receive the highest number of hate crimes perpetrated against any other religious group. Because of this reality, as most people were busy cooking and otherwise preparing, I saw that one of our community leaders had to go and brief the police officers at roll call at the 66th precinct in Borough Park to prepare them for the increased amount of activity on the streets in the coming weeks and days. So I'm wondering, what impact do you think the many anti-Semitic ideas, mischaracterizations, and flat-out lies about Jews that currently air on television have on the number of hate crimes that are launched against Jews? And also, can we expect to see that extra police presence continue until the end of September as our holidays continue?
Yes, absolutely, Yehudit. We want that focused presence to protect Jewish communities. This is a very crucial time of year for the Jewish community, but also a sensitive time of year where we have to provide that protection. We will be doing that in communities all over the city. But to your bigger question, this is something I've been talking about for years and years, and I had the occasion in Israel after a visit to Yad Vashem to talk about how the cancer of anti-Semitism and the violence that comes from it was never eradicated after World War II, despite a lot of, nice words telling us that we had turned a corner in Western nations. It wasn't true. The remnants of fascism and Nazism reasserted themselves in many ways, and the nativism we're seeing in this country now, in combination with other malevolent forces. So I think the bottom line is there's a lot of anti-Semitism in this world. There's a lot of anti-Semitism in Western nations where it should have been eradicated. It is a threat to Jewish communities. We have to be vigilant at all times. That said, we can't give up hope of overcoming it. We have to overcome it. And I do think with each new generation, we have more opportunity to create a world without prejudice and bias. And that's the work we're doing every day to educate our young people, and I'm hopeful about that. Go ahead, Yehuda.
Okay, thanks. And then after 18 months of landlords having been barred from evicting tenants who could not or would not pay their rent, on the night on which the Supreme Court said that the CDC did not have the legal authority to continue the ban, you severely criticized the Supreme Court majority who made the ruling, which Governor Hochul and the New York legislature just extended to January 15th. So I'm wondering, as the country's unemployment rate currently stands at 5.4%, and it has been reported that there are more jobs available now than people who are applying, and unemployment claims have really dropped by 35,000. I'm wondering whether you are worried about the livings and properties, the well-being of property owners who have not received rent from some tenants now in a year and a half. And I'm also wondering what motivation they have to continue making repairs and safety upkeep in buildings for which they're receiving no rent.
Yehuda, I'm very worried, and we have to strike a balance. I think the power and the common sense of the eviction moratorium is that we've got a huge number of people who are not back on their feet, who do not have work. Yeah, there are some jobs out there, that's true, but there's a huge number of people who can't get those jobs or who have lost jobs that paid them a lot more than the jobs that might be available now. There's a lot of people who are still suffering the effects of COVID. There are so many reasons why the danger of putting people out on the street en masse, horrendous morally in every way. So it was right to say, especially since Delta came back into our lives, we needed to continue the moratorium. But I am very worried for building owners too. I know the vast majority of building owners try and do the right thing. They try and keep up their buildings properly. They often have thin margins. That's why the rent relief has to be achieved by the state of New York. That's a huge amount of money that could then reach tenants and ultimately the building owners as well. There's thankfully a lot of support out there, but we have to actually get it to the building owners. And I understand the building owners have a lot of tough choices now. My hope and my dream is we get people vaccinated, we end the COVID era, we restore our community and our economy, and then people have the money again to pay the rent, and we go back to a much stronger situation. But again, for every building owner out there who is dealing with a very tough time, I do feel for them. But the answer to all of this is get people vaccinated so we can turn the bigger corner. And I have absolute confidence we're going to do that. Again, 78% plus of all adults in New York City have had at least one dose. That's what's going to move us forward. Thank you, everybody.